have all kinds of parts of this complex $3 trillion healthcare system, and we're not solving the individual problems of people who need help.
It might be okay to have the most expensive healthcare system in the world if we were getting the outcomes that we all wanted, but unfortunately nobody's happy with it.
We found that more and more healthcare dollars were going to people who did things to people instead of to doctors who did things for people.
The shift to value is not this negative and punitive thing in our healthcare system. It's actually the single biggest opportunity that we can create for physicians truly to take back control of healthcare.
How are you? I'm good. Good.
VillageMD delivers the tools, the teams, and the strategies for primary care physicians to deliver the type of care that they want in the way that a patient wants it.
And so it's this whole model that works as one system. It's about getting the right contracts, having the right level of data and patient insights, having the right level of resources who are there to support the PCP so that they can deliver a different kind of outcome to their patients, and then being rewarded for it and creating this nice cycle of a better patient care model.
The first thing that we have to find is a physician leader that we want to bet on. We bet on that physician leader because they're viewed not by us, but by their peers as a leader in the community. What we then do is take our model to the health plans in that market and engage them in a discussion around value-based reimbursement. We bring them a contract where the economics are more advantageous for them. They get to participate in the economic value that they create.
We sit down with the physicians and we bring them data and insights about their practice, which more often than not, it's the first time they actually see relevant information about their patients.
In a population that a primary care doctor takes care of, up to 10 or 15% of those patients would be defined as complex or chronically ill. Those patients require far more attention and touch and resources that could ever be delivered by a single physician. We can deliver primary care services to a patient in their home. We engage a chronic care management team that usually involves educators, social workers, disease managers, transitional nurses, to make sure that patients get everything that they need under the direction and supervision of that patient's physician. Everything from patient education tools, rooming guidelines for our nurses, outreaches to appropriate patients so that the right patients are seen at the right time by the right physicians. At Village, we step in and do the legwork that we all wish we had time for, so that when you see a difficult and complicated patient, that you can actually spend your time doing what only a doctor can do, which is deliver the medical information and interventions that we've been trained to take care of.
One of the key components of what we bring to help physicians is growth. We help them in a couple of different ways to do that. One is to identify other physicians that are like-minded that might want to participate in a model like this and recruit them. The other thing that we do is we provide the ability to drive incremental services within their practice.
Our technology is really built in a way that allows us to be completely agnostic around what EMR a physician happens to be on.
At Village, we've been delivering results that we are proud of. And those results include improved utilization, as much as 20 to 45% reductions in inpatient admissions, decreased ER utilizations, and quality scores that have been recognized at the same time by every major payer, including the Primary Care Medical Home and NCQA.
And we're doing it in a way that doesn't go in and say to the physician, we need you to say goodbye to over 70% of your patients so that you can work in value-based care. We enter into a long-term partnership to make sure that the physicians know we're going to be there. We are willing to invest and work side by side with the primary care provider to help them deliver the kind of care that they've always wanted to deliver for their patients.